Hi, I'm Dr. Broussard with the Wagon Train Veterinary Clinic, and in today's segment we're going to discuss dog dermatology. My assistant Cole and I have come up with a list of questions, and we're going to run through these to help you get a better understanding of dog dermatology. Cole?
Dr. Broussard, what causes skin problems in dogs?
Ooh, right out the gate, that's kind of a hard question. Very broad question. It can be anything from allergies to parasites to certain endocrine disturbances like thyroid issues, those kind of things. Any and all of those can cause skin problems of umpteen different varieties.
Are dermatology issues painful for my dog?
Sometimes, yeah, depending on what they are. There are some that may simply cause hair loss. That's not particularly a painful thing, but the most common thing we see, allergies, dermatitis, inflammation, yeah, those hurt, they itch. The skin is red, it's irritated, it may burn. So yeah, of course it does cause a little bit of pain. No different than if you had a rash or poison ivy on your arm. Same type of thing could apply to a dog, yeah.
What are some signs and symptoms that my dog may have a skin condition?
Again, very, very broad. The most common things that I see are hair loss, scratching, obviously, scabbing or sores on the skin. You can have simply redness on the skin. You can have hair loss in or around, the eyes. Ear infections are another very common thing, so redness or excessive wax and odor from the ears. The feet are a big one. They will lick and chew at their feet for a lot of conditions. Fleas, flea dirt, or flea droppings, if you will. Ticks, pretty obvious there. Any of those would be some of the first signs that we see of skin conditions.
What test will be performed to diagnose my dog's skin condition?
Good. If I have a very advanced skin dog come in, typically I look at three different things. Number one is doing a skin scraping. So what a skin scraping is, as the name implies, we take a very somewhat dull blade, but actually scrape the surface of the skin, put that on a slide, and we're looking typically for parasites. And I'm not talking about fleas, I'm talking about parasites that live in the skin, like mange, Dermatitis mange, sarcoptic mange. That would be step one that can be done. Number two is ears. Again, I mentioned already, dogs, it's very, very common, dogs with allergies especially will have an otitis or infection or inflammation of the ears, and oftentimes they'll have a secondary infection in those ears, so we take a wax sample from the ears, put that on a slide, and look under the microscope. That's a very common thing we do there. In some cases, we will also need to do what's called a DTM, which is where we pluck hairs and test for things such as ringworm, those kind of things. So again, those are all tests that can be done. There's sometimes a simple staph infection can be diagnosed just by a physical exam, because we see those all the time. Did I say all the time? All the time. So sometimes we can pick up those just on a simple physical exam. So, yeah.
What are some common skin problems in dogs and how are they treated?
This question could take 10 minutes to answer, but I will not do that. Common skin problems are allergies, allergic dermatitis, if you will. Atopy is another name for it, all the same. But allergies is one. Staph infections, very, very common. Yeast infections of the skin and or ears, very, very common. Ear mites, not as much in dogs, more of a cat thing, but it happens in dogs. Ear mites can do it. Fleas, ticks, Dermatitis mange, sarcoptic mange. Those are some of the big ones. And then you also have other skin problems that can be brought on with autoimmune disease, pemphigus, lupus. I'm going to stop there. So those are some of the conditions that we do see. The treatment, as you can imagine, it varies. It really depends on what the diagnosis is as to how to treat it. So I really don't want to spend too much time on treatment because we have no basis to know what we're treating in this question.
What if my dog's skin problems go untreated?
Depending on what they are, some can be very, very serious and have your dog living in discomfort if they go untreated. Some are less noticeable. The one that comes to mind, like there is a chronic alopecia that I'll see like in older boxers, for example. It's a symmetrical hair loss and nothing else. The skin's not red, they don't itch, it doesn't burn, nothing. The dogs have no clue they have it. If that goes untreated, fine. You just have a dog with a little bit less hair. But if you have severe allergies, whether it's flea or food or anything like that, and those dogs are itching to beat the band, which we see all the time. If those go untreated, that's going to lend itself to secondary bacterial and fungal infections. That's going to just have a dog in misery. Some of those dogs lose weight. Some of those dogs don't want to play or do anything. They're just miserable. So it can be either one of those ends of the spectrum depending on what condition they do have.
What is the difference between atopic dermatitis and contact dermatitis?
Ooh, that's a good question. Atopic dermatitis, by definition, is atopy. Atopy is a fancy word for environmental allergies. So meaning, if I go outside and I'm allergic to pine trees and I live next to a pine forest, I'm going to have atopic dermatitis. Perhaps if I'm a dog, I will. So that is environmental allergies, and it's typically in the air. I can just inhale those allergens and be affected by that process. Contact dermatitis, as the name very much implies, is if I touch something. Maybe I'm allergic to St. Augustine grass, and that's what's in my backyard, and I'm a dog, and I go lay in the grass. Well, obviously, I just contacted what I'm allergic to. So it's usually a very localized area in the area that has been exposed to the offending allergen. So, is that it? Oh, no. Continue.
What are curable versus incurable skin problems in dogs?
Ooh, curable infections would be something, if you have, say you have a staph infection, a bacterial infection, for no underlying reason, and nothing that's going to be chronic. Maybe your dog just was sick from something else, immune system was a little bit depressed and got a staph infection. We treat that with the appropriate dose and duration of antibiotics. It heals up and everybody lives happily ever after. That can be one scenario. The incurable things, allergies. How do you cure allergies? You can't. God made them that way. They may require treatment for the remainder of their lives, and quite often they do. So that's something that's incurable. Some of the others that are really incurable are the autoimmune diseases. I mentioned earlier, pemphigus and lupus and those type of things. Again, that's something you can't take back. You can control it, you can treat it, but you can't cure it. So some of these conditions are just going to have to be managed for the life of the dog. That's the last question. So thank you guys for tuning in. I surely appreciate it. If you have any questions or comments, reach out to us, website, Facebook, or just call us directly, okay? Thanks again for tuning in, and we'll see you soon.